Good morning, San Diego. Welcome back. And as many of you already know, we're well into spring allergy season, but sniffling and sneezing can be confusing with symptoms of worse problems. To find out more, to determine what it is, we're going to talk to Dr. Angela Chang. She's an ear, nose, and throat specialist with California Head and Neck Specialists. Good morning.
Good morning.
Okay, it's spring, but year-round we have problems with allergies, right? It's not just spring.
Right. In San Diego, we have a very unique climate here, so a lot of people tend to have symptoms all year round. But especially in the spring, or especially with the weather that we've had in the winter with all the rainfall, I've definitely seen in my own practice a lot of patients who typically don't have allergies have had a lot of allergies this year.
Yeah, with the super bloom across the county, not just the deserts.
Right.
So how do we determine if it's a cold, if it's a sinus issue, or if it's allergies?
Well, typically with allergies, you're going to experience nasal congestion, sniffling. These symptoms are very similar to chronic sinusitis, which I've also seen in my practice this year. People thinking that they have had allergies for an extended period of time, but it's actually chronic sinusitis. Typically with sinusitis, you'll have a lot more pressure over the sinuses. The sinuses are air-filled cavities behind our face, our cheeks, our forehead, and around the eyes. And typically you'll also have some color drainage accompany that as well.
Yes, I know. I have dealt with those for a long time. So, okay, so if it's not sinuses, if it's allergies, what do you recommend? How do we figure out that we have those symptoms of allergies, and what do we do? Do we need to take a test?
Yes, with allergies, it's a simple test either by blood or even a skin test on the back that can determine what type of allergies you may have and how severe the allergies might be.
Okay, and the symptoms for allergies are, sneezing,
sniffling, sometimes cough, runny nose, postnasal drainage, and nasal congestion.
So it is confusing because it's very similar.
It can be very confusing.
Okay,
yes.
So if you determine if you have to, obviously, you have to go to the doctors.
Right.
And figure out if it's allergies. If it is, if you're allergic, you determine what are you allergic to, right? As well?
Right. You find out what you're allergic to, and sometimes we can do allergy immunotherapy, which is a way to desensitize patients from these allergies.
Really?
Right. But sometimes it's more than allergies, and it could be chronic sinusitis, and there's just been a lot of new technologies that we have available, which we didn't have many years ago. We do a lot of balloon sinusplasty now, where we can actually open up the sinus cavities with a balloon, even in the office sometimes.
Wow.
And we also have a new stent, a Propel stent, which sometimes we actually have to go to the operating room and open up the sinus cavities in order to clear polyps or other chronic inflammation. And then we can actually place this implant, a device that actually delivers steroids and also helps prop the sinus open.
That's
while
amazing.
It's doing that. So you get targeted therapy to the tissues that really require it.
And it works. It diminishes, or it just takes it away completely, the allergies.
Right. So we open up the sinus cavities. This is when you actually have a chronic sinus issue. We open it up surgically, and we place this implant in there. And as it dissolves, it actually is going to be also delivering targeted medication, targeted steroids to the area. So it really improves inflammation. It improves, and reduces scar tissue for patients who are recovering from sinus surgery.
Wow, that's incredible. So aside from just the regular medicines, over-the-counter, Allegra, do you have other technology?
Right. And this is if your allergies, because we see a lot of allergies alongside chronic sinusitis. And a lot of times these are the most difficult patients for us to manage, who have both allergies and sinusitis.
Yeah, it could become chronic. So do you do that for children, or is it mostly for adults?
Mostly for adults, yeah.
Okay.
FDA
and how do you
adults.
treat children, too?
Children, children in a very similar way, but obviously we try to be less invasive in terms of surgeries. But with allergies, the same thing with nasal steroid sprays, sometimes allergy medications, Claritin, Allegras, or a Tech.
Yeah, okay, wonderful. Those are wonderful tips. What do you recommend in terms of being outdoors? I mean, we're outdoors all the time. We're hiking. You can't avoid it, right?
Right. I think that if you typically do have allergy symptoms, it's always good to take an allergy pill before you're going outside, or if you later on develop symptoms. I like having patients do the saline rinses to rinse out all the pollen that's been inhaled, and I think that patients tend to do better that way.
That's a great idea, before hiking or going for a jog in the outdoors.
Yeah.
Thank you so much, Doctor. Those are great recommendations. Well, thank you.
Sure.
I'm going to have to get your number because those are great tips. I did not know that.
Yes.
The San Diego Food